Hey guys, so the following video would be about your step 2 exam of the USMLE. So step 2 consists of two parts. It's CK, which is a clinical knowledge, and CS, which is clinical skills. So clinical knowledge is basically your second and third and fourth year subjects, medicine, surgery, obs, gynae, pediatrics, and the similar subjects of your step 1, such as biostats. There might be some part of genetics, but biostats, ethics, psych are the important subjects which carry on to your step 2 exams too, because basically what we have to understand is that US is a research US healthcare system is a research based healthcare system. There's a lot of emphasis on ongoing research and ongoing on application of evidence based medicine in the US. So they require you to know a lot of biostats, how to read papers, how to analyze things. So that is an important part of your curriculum over here, which we are not taught. So it continues. And then there's psych, there's ethics. These things continue in your step 2 CK. So CK, I would advise, for example, as we used a first aid in your step 1, what I used is MTB. It's Master the Boards. It's a book by Conrad Fisher. He's a famous guy, apparently. A lot of people in GMC Srinagar used to see Conrad Fisher videos. I never watched any videos. So it's a book by him. Then some people do go ahead with first aid for step 2 CK. I didn't. I just did the MTV. So whatever rocks your boat, whatever you feel comfortable with, you can use it. I would advise MTB, as it's a tried and tested model by me. I wouldn't say the results were as good, but that's what my advice is. At the same time, the crux remains the same. UWorld. Yeah, let's be honest. UWorld is the most important thing you can be thorough at in your steps, and the same goes for your step 2 CK. You start with UWorld, and you annotate everything you get from UWorld into your MTB, and at the end you revise it, and that is a very soundproof way and a very good way of going ahead into your step 2 CK exams. At the same time, there are Kaplan books. That's a buttload of material. I wouldn't say if you have the time. I had just had 4 months, so I couldn't do that. So if you have time, just do it. Just be thorough with your clinical scenarios, because there are a lot of now in step, what you have to understand in step 2 CK is that it's a clinical based exam. You have to understand treatments, you have to understand treatment protocols, you have to understand which of the treatment strategies you have to go ahead in different kinds of patients with the same disease. So that becomes very important, and so you need to be thorough with it. Kaplan teaches you that, MTV teaches you that, but the thing with Kaplan is that it's just too much. I couldn't do it. If you can, well and good, it would be awesome, it would be amazing. You'd get a lot more marks if you do Kaplan, but it depends on your time. If you have time, then yeah, well and good. If you have started early and you have created a very good timeline for completing your steps by September, then it's great. At the same time, I would advise regarding video. I didn't speak about videos in my step 1 lecture. Some people like videos. I did not see any videos except a few video. I would say I did see genetics. I did see the entire lecture of Kaplan on genetics. I did see some videos in biochemistry. And of course biostats and ethics, I did see all the videos, because I was very weak at that, so I wanted to be very thorough. And trust me, even after seeing so many videos, even after reading a lot of books on biostats and ethics, my performance was abysmal at the end of the day in those subjects. So that's why I advise you again and again, just be thorough with these subjects. you will read a lot about on these subjects, and then you'd say, okay, I'm the guy, I can solve any question. But during the exam day, it's a different ball game. It's a different setup, and you tend to screw up a lot. So I would say these subjects are important, and the videos on biostats, ethics, psych, maybe genetics, and a few lectures of biochemistry, you have a difficulty in understanding certain concepts, would be a good goal. And you can, I mean, if you like videos, you can watch them. If you have time, you can watch them. I did not have either of them. I did not have the capacity, not the time. So if you can, well and good. I would not say don't watch them. It depends on person to person. It depends on how people study. So that's that. So basically, UWorld plus MTB is my way of going ahead for CK, because I had less time. You can do Kaplan too, and try to be thorough. Try to revise your UWorld again. I was not able to revise my UWorld again. I just did it, I think, once. Probably some part I did revise. I can't recall right now, but that's the way going ahead. So that is your CK, clinical knowledge. And then there is CS, which is the clinical skills exam. So this is a big one. Let me be honest. Your way going ahead, it's like a barrier. It's like a gate, which either decides whether you go ahead or just forget about your USMLEs. So it's a pass and fail exam. There are no marks for it. There are a set of 12 clinical scenarios. There are patients in each room. You have to go, there is a dedicated center at 5 places in the US where the CS exams are held. So there, in the center, there are 12 rooms. I would say 12, I can't recall, but I think there are 12 rooms, and each room has a patient, which is actually an actor, which the actor has a history, which he has learned, or he has read the paper, read the script, and it's a scripted thing. You just have to enter as a doctor the scenario. You have to take the scenario as it is a real thing. The patient gives you real time history, and during the physical examination he would act on the complaints. For example, if there is asthma, if the case is asthma, he comes with a complaint of shortness of breath and wheezing, and at the same time, when you will examine him, or when he will be in the room, he will do he will play his part of an asthmatic patient. He will be wheezing, he will be short of breath, he would be acting like it's very difficult for him to breathe. So this you have to be ready for this. This is the most important part. The patients act out really well. They're not going to scare you. So the basic thing here is you have to there is a book, First Aid for Clinical Skills. So it has a set of cases and how to go about those cases. So basically what these people want is to learn about 3 things. So the CS exam is scored on 3 things, which is your English, spoken English proficiency. That is one part. Then there is integrated clinical encounter, how you did the clinical encounter, and then there is your interaction with the patient. I can't recall what it's called. So basically your performance is evaluated on these 3 pillars. So how it is evaluated is that the patient, the actor has a list with him. So when you have an encounter with him, and when the encounter ends after 15 minutes, so what you do is that what he or she does is he or she ticks out the things you did, whether you fulfilled all the criteria. So it depends on the number of ticks you get, whether you pass in a certain case or fail. So that is how it occurs. You have to be really good at this thing, because it's all a matter of nervousness and anxiety over there, because it's a pass and fail exam, and then too much pressure of all the expectations and all these months you have been preparing. You finished with your step 1, step 2 CK, and now this godforsaken thing comes, and it becomes difficult. But at the end of the day, I think most of the people pass, and I'm very sure that people from GMC will pass too, because they have very good English and they interact really well. They have very good exposure to clinical scenarios. But the basic pathway going ahead in CS is practice, 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 practice 3 times, and practice 5 times. So practice with your fellow colleagues, with the people giving USMLEs, practice with your friends, make them act as patients and just put up complaints. Their first aid does a very good job of giving cases and having complaints for each case, so that people, your friends, can read up those cases and uh, try to show up those complaints during the clinical scenarios when you will act as a doctor and they as a patient. You can do your practice on Skype too. I did a lot of practice on Skype, however much I could. I did not study much regarding it. It was a very tense time for me that time, because I was doing a rotation at the same time. So I would advise practice a lot on Skype, on people in front of you, or on your family members, even if they're willing. If you can't find anyone, as was the case with me, I did not have anyone to practice with, so it was a tough time for me. I would say that you might have a lot of friends when you're in Kashmir, so do it in Kashmir, practice a lot. At the same time, there is a UWorld course too on step 2 CS. It gives you, it's the same thing as your first aid, so I don't know how helpful it might be for you. First aid is the crux, the basis of it, has all the important cases which might show up in the exams, and you can practice each of the cases, and then go, and most of the cases come from first aid, because they just want to test the basic clinical scenarios, not something out of the blue or something which is very rare. There's always pneumonia, there's always COPD exacerbation, there's always MI or back pain. So these are all very simple cases. So that is how CS is done. They will mark you on each case, the patients, and then going ahead, you would have to pass. I mean, there is no data on how they do it. The very idea that they tick mark and what all they tick mark, some people have deciphered it, some people have posted things online. I don't know how much of it is true. You can check it out, if you can. I mean, most of the new things which come up in CS, you will be more acclimatized or more exposed to it once you come into the US, because the exam is only given in the US. You can't give it outside the US, as is the case with step 1 and step 2 CK. So you'll get more exposed, and you'll have a very good approach towards CS while coming into the United States. I would advise that you do some rotations before you give your CS. That gives you a very good idea about how to interact with patients, what is expected of people over here, because the most important thing here is that 99% of the US medical students pass the CS exam, and around 75 to 78% of the IMGs pass the exam. So it's not a matter of knowledge, let's be honest. The stats prove that. It's a matter of how you interact with the patients, whether you were empathetic to the patients, whether you it's not that you have to be empathetic with the patient. It's just a matter of acting. And if you act well, if you kind of show the patient that I'm empathetic towards you, that I understand your problem and I'll do my best to solve it, even if it's acting. It does not have to be a soulful, tete-a-tete with your patient. It can be acting, and if you do your acting well, if you fulfill all the tick marks on the patient's list, well, you're good to go. You're gonna pass with flying colors. But out of all the exam, I mean, every exam has to be taken serious, but this is like a threshold you have to pass. If you're gonna flunk in your CS, it's a problem. It's a big problem. Even if you have a stellar scores in your step 1 and step 2 CK, fail on your CS is a big deal. Let me be honest with you. You don't want to fail on your CS. This is the most important exam, I would say, in which there is a good chance that, I mean, there's not a good chance, sorry. There is a chance that there might be, you might have some trouble because it's a different thing. It's not what we do back home. So I would advise to do good on your CS, and yeah, that's about it. I don't think I have left out anything. Practice is the most important thing in CS. There are a lot of videos. So what I didn't say is during your 15 minutes of, I mean, there's a 15-minute interaction of your CS with the patient. So in that 15 minutes, you have to do your history and physical examination, both of them. So it's a focused physical examination. You know more about it after you read the book, and what all the cases entail of you. So at the same time, then there are 10 minutes in which you have to type in the notes. So here is where you're endless chatting, and if you might be chatting on your laptops or on your computers, so that helps. You need to have a very good typing speed, guys. So 10 minutes you have to type in the entire note. There is no it's not a note which we do in SMHS. Okay, the patient is awake, BP, pulse, and whatever. It is detailed note. It's a detailed history, this detailed physical examination, and then you have to give a list of diagnoses. So the diagnosis should be appropriate from the number 1 diagnosis, which is the most probable diagnosis, to second and third. It does not matter if there is no second and third diagnosis, if you're not able to decipher a second and third diagnosis, but there has to be a first diagnosis, and there have to be points supporting, 3 points supporting from history and physical examination of each of the diagnoses. So the software which goes into writing the notes, you can find the software on the USMLE website. At the same time, there are a lot of other websites too which give you the software. I used to use a website which was USMLE CS Practice. So it gives you a chart, which is the actual chart which you get in your exam, in which you have to type the notes, type the examination findings, and type the diagnosis and the tests you're gonna do going ahead with the patient. So after each patient encounter, you get 10 minutes to type in the notes and the further and what further assessment you would do with the patient. So I think this is the most important thing. CS, you have to go ahead, be strong with it, be very thorough with it. Don't play with your CS. Let me tell you guys, it is a very important exam. So that is about it. If you have any questions, any other things you want to know, just put it in comments, or give me a message, give me an email, or whatever it is. I'm always here to help you. You have a lot of seniors over here. I mean, at the end of the day, it's your journey. You have to be thorough with every aspect of it. No one is going to spoon feed you things. I mean, being in Kashmir, we are very accustomed to spoon feeding, and I mean, I guess most of us are born with a silver spoon in our mouth. So this process entails you to be independent. Basically, do all your steps yourself. Okay, you want advice, take your advice only after you have thoroughly gone through everything on the internet, on the websites, and you have done your study, and then you can ask for advice. If you're not done your study, which is the case with majority of the people who come to me, I mean, no offense to anyone, I was like that, but I learned it the hard way. You have to do your study, you have to do your stuff, you have to know the basics, you have to kind of know the topic you're talking about. For example, electives or observerships or stuff. I'll do a video about that too, of the things which we tend to do wrong during the process. But I'm always here. I would help you in any way I can, and let me know how you find the videos, and have a good day. Bye bye.